I welcome everyone. This is our start of the year 2025 monthly webinar, informational webinar for weight loss surgery in Mexico. And today we have pleasure Dr. Alejandro Gutierrez to join us from our hospital facilities, our new hospital facilities. New year, new hospital, everything is looking great. And just to reiterate about our raffle that we do every time, you get a $2,000 off of your surgery package by attending this webinar to the end. And all you have to do is to have a HQ in our system. And Dr. Alejandro Gutierrez is the one who will be performing the surgery. So that's the only surgery we are doing the raffle for today. And make sure you attend to the end of the webinar. If you have not let me see, there is a if you do have a HQ in our system, please, you don't need to resubmit it again. And I see a lot of you that are saying hello, good morning. And of course, some of you guys are in a different time zone, so good afternoon. We appreciate you. Thank you so much. There was, yes. Yeah, like, that's good. I mentioned Wendy is in Los Angeles. Our prayers with you guys. It really, we very closely feel the situation that you guys are going through. We're very sorry for that. Okay, so to do the health questionnaire, you just need to go to MexicoBariatricCenter.com. And if you type /health-questionnaire, that would take you, or it would be right on the top. It says fill out a health questionnaire. Okay, so, and then again, if you have a HQ already, you don't need to submit it. If your doctor is different, we can switch you as long as Dr. Gutierrez is a surgery that is in the expertise or the list of surgeries that Dr. Gutierrez performs. Just a quick note about myself. My name is Ron Elli. I am the CEO and founder of Mexico Bariatric Center. I started in the medical tourism in Mexico in general in 2007, and I started 2012 NBC, and it's a registered trademark. We have done easily over 25,000 patients, and we have helped a lot of people. And I started a project for enhancing our services by creating Hospital Azar in Tijuana, and we were successful to finally open it in last year, September, and we've been very successfully performing surgeries there, and patients are ecstatic. They love it there. So there you go. So that's a little bit about me. We would try to answer as many questions as we think a lot of you have. And but if we don't get to it, please go ahead and call back because we try to keep the webinar to a certain amount of time so we don't run into to your schedule, your day's schedule. Take it. So if you don't hear or if you don't get to the questions, of course you can ask it in the chat, but if you don't get to it, please go ahead and circle back with us and ask. We have also starting next week, hopefully, we're going to have our surgeon live again. So you have opportunity on a weekday and a Saturday, and we're going to rotate all our surgeons, the 5 surgeons we have, between Wednesday and Saturday. Saturday probably going to be 10 a.m., the same Pacific time again. And Wednesday, we haven't decided. We would announce that probably 1 p.m. And we would have a live for our surgeons so you can ask specific questions you have. Again, you see our approval process, and you will see that really everything we do is to take care of the best for your situation to get your information in. But if you still need more support, of course, our coordinators here, our surgeon liaison is here, and our surgeons we're going to make it more available. And again, we do the webinars every Saturday, 1st of every month. The only, sometimes we move it because of the holidays happen, or like Super Bowl, or some occasions like that we move it to the second week. But usually it should be on the 1st Saturday of each month. So you know when to join us. And honestly, I see sometimes we end our webinars with 50, 70 questions unanswered. We really appreciate those questions. And I'm sorry that, I'm going to try to go through the presentation faster this time so we get more time for your specific questions and try to address your concerns. So anyway, so the topics we're going to cover today is we all know what obesity is, the risks of obesity, how to calculate your ideal or goal weight after weight loss surgery, and what does really weight loss surgery do? How does it change your metabolic system? And what is the difference between that and medications like Ozempic, and diet and exercise? And what's the difference? Why is this so effective? And then we're going to talk about NBC, where we come into picture for people who are not insured or underinsured, or the insurance doesn't give them the coverage, for people like in outside of US, like Canada, that they don't, they have it, but they have to wait a long list. Remember, this is a life-changing tool and experience and surgery that the sooner you get, the better you are, because you just change your life. And that's why this is the beginning of the year, and this is an opportunity to change your life at the beginning of the new year. And why not today? Why not now? And then we're going to talk about all the support programs we have, and we're going to talk about why really NBC, the hospital we have, the organization we have. I was counting the other day, Dr. Gutierrez, and I figured we have about close to 300 people working in the NBC team, from our staff in US, all the supporting staff in US, the transportation, our coordination, and the surgical teams, right? So you guys all are individual surgical teams, and it's not like just bunch of faces, and really they work together, you know. And that's why we're going to put your pictures out for each team. We're going to put the pictures of the staff out so people know what is really behind all this. Because when you start looking to get the surgery in Mexico, there are, you know, Google ads, Instagram, Facebook. There's so many resources that pops up. And how do you decide which company really is the one that fits you best? And we're gonna justify why we are number one, and we're gonna justify why you should choose us and not look anywhere else. But basically, these webinars help, you know, and then we're gonna have more lives, and then you know what is really behind the website, behind. And another thing I always say is like, okay, you know, who is running these companies? You know my face. I've been around for so many years. Actually, when I come to hotel or hospital, a lot of people know me, and a lot of people know me from the webinars, and they say hi to me. And anyways, so that's pretty much the outline of our talk today. And then at the end, we're gonna do the Q&A and finish it with the raffle. We all know what obesity is in the medical field. There's a definition, there's a formula. You put your weight and height, and there's a calculator that tells you where your BMI is. So if BMI of over 30 is considered obese, we usually do procedures for BMI of over 30, but some occasions, we have some of our surgeons that they consider maybe 28, 29. But again, that's why we have a team of surgeons that they all have different criteria, different skills, different backgrounds. So anyway, and then another fact that is unique about us is we have no limitation of how high of a BMI we can handle in our center. So we have done a BMI of 110, for example, 100 plus. You know, when you watch my 600-pound life, we are the 600-pound life version of Mexican version of that, because we do this in Mexico. You know, we all know what are the cause of our being overweight and obesity. The sugary drinks, the ultra processed food, lack of physical activity, that's huge. You know, we sit around all day, work, and go home, we're stressed, we're tired, we eat, and there's not enough activity. Very simple. Of course, genetics, all that plays a huge role in this, but you know, and we are in US used to having large meals, and it's actually accessible too. You know, like we go to Costco, we just you know, come back with the anyways, as we actually, I need to show this figure first. As we gain weight, our fat cells or adipose tissues change their structure, and it causes all the inflammation in our body, which creates insensitivity to insulin, which is diabetes type 2, insensitivity to leptin, and even we become insensitive to protein and exercise. So when we are obese, all the protein we take and exercise we do is really not so effective. It's like the way the muscles respond when we age. So is 40% of US adults are struggling with this issue. Um, it it affects, yeah, it affects our lungs. Look at this animation.
Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take.
So basically, this puts pressure and stress on all of our organs and all over our body. Cardiovascular disease, diabetes type 2, like I said. When COVID happened, we learned that, hey, we need to trim down. And either that or we ended up in hospital, in ICU, and more chance of dying. So what are the solutions to obesity, morbid obesity and all that? So first, we all try that, right? Diet and exercise. Diet and exercise is great. We need to do that all the time anyway. But for somebody who is genetically affected or lifestyle affected, it's not going to be a proven long term. And we're going to see real short of the effectiveness of all these different tools that we have available. And then is the medications. From the start of human civilization, we always looked for a magic pill. In this case, is an injection to lose weight fast. And that's not a long-term solution either. We're going to see in case of, for example, Ozempic, which is a breakthrough medication, you still have to take it long term, or it won't. If once you stop, it will come back. So at this point, at the current time, the only proven, fast, quick, safe, and long-term solution for curing obesity is weight loss surgery. Again, this is how our body reacts when we go on diet. Okay. So I said, okay, so the reason that bariatric surgery is so effective can be very simply explained in here. Basically, bariatric surgery calibrates or resets our metabolic system. This is a metabolic disease. Obesity is a metabolic disease, and this resets our metabolic system. And the way it does that is because it changes our hormones and creates restriction in our stomach. And that's why it's so effective. So again, let's say if I weigh 250, my body, which is the interaction between my brain and my hormones, my gut hormones, is used to that weight. And anytime I go on diet and want to change that, it's gonna react by making me more hungry and lowering my metabolism, because my body wants to bring me back to that 250 pounds. But the minute you wake up from the surgery, your body, because of a hormonal change, sees you at a lower metabolic thermostat or metabolic system reset. And your body reaction to that is you get less hungry and your metabolism goes up. So you burn the fat. That's very simple. And that's the difference between bariatrics and diet and exercise. Now, Ozempic. Ozempic class of medications are basically trying to simulate the naturally changing hormones in our body. So when, again, we talked about, so when you do the weight loss surgery, all these hormones on the right side that you see from ghrelin, CCK, GLP-1, GIP, all those changes. Again, and plus the anatomical changes in our stomach, which is restriction, it will create a long-term solution and a fast solution. With the Ozempic, they're trying to simulate with the synthetic hormone the same effect of GLP-1, and now they added GIP-2. So Mounjaro has, for example, has both of these hormones, but you're injecting a synthetic hormone to simulate part of the hormonal changes that is happening naturally in your body. And that's why you have to keep taking it to keep the weight off. And now, what is going to be the long-term effect of taking this, right? It's huge. So many, and then it was a new study done that 60% of people who start Ozempic, they don't continue. The reasons are all these complications, the gastric problems, nausea, whatever, and the cost, right? So, but again, it's a great tool, but it only works for so many people. So diet and exercise, let's say 3 to 5%, semaglutide, GLP-1 medications, 5 to 10%. Then we have the endo procedures like ESG, which is endo sleeve and gastric balloon. Again, that works for people who are disciplined and they just want to jumpstart on their weight loss. And that is good for 10 to 15% of the population. And then becomes bariatric surgery, which is the ultimate gold standard, like sleeve bypass, which Dr. Gutierrez is going to go into detail. And again, MBC, Mexico Bariatric Center, is a top coordinator for bariatric and plastic surgery for people who are uninsured or underinsured to go get quality services, most of the time better than what you get in your hometown in Mexico. And you know, from the surgery point of view, from the care you get down there, is tell you what, it's far exceeds a lot of people places in US and Canada. And we're going to see why go with a coordination company like us. Even CDC recommends a coordinating company like MBC, because we basically, MBC is equal to peace of mind. You go with us, you don't have to worry about transportation, hotel reservation, your companion. We offer medical tourism insurance. There's so much that we offer, and you see why MBC. Again, we are a US-based corporation, and we have over 12 years, soon be 13, with easily over 25,000 bariatric performed successful surgeries with top 5 bariatric surgical teams in Mexico. Now, since we started publishing these numbers, because they are so impressive, all the other companies and individual surgeons that they're working on their own, they started claiming the same stuff. And again, you know, they're coming up with crazy numbers like, oh, we've done 10,000 and 5,000. Anyway, this is real, guys. This is real. I mean, um, there are so many reasons that you choose us, and these are the reasons. And if you want, I can go over it, or you could just glance. Um, you know, there's so many reasons to go with us. Our reviews. Again, you know, social media is always misleading because there could be uh, a two people company and they put out some advertisement in TikTok and Instagram and they put cute stuff there. And then some of these before after pictures, they may not even be theirs. They could be Photoshop. Just do your research. If you do your research, you see there is no provider in Mexico that even come close to MBC. And one of the important factors that you want to consider is the range of procedures that we offer. You're going to see, because Dr. Gutierrez is going to go over what we offer, there is no company that has a complete bariatric solutions from endo and laparoscopic, the different type of surgeries that we can handle. We are not going to give you something which is not good for you. Because to us, we'll try to match you with the best surgeon for the best surgery for you. And um, you see a lot of the surgeons nowadays, they're trying to run their own operation. But believe me, we know them all. They're either assistant surgeons that they just started. Yes, they give you attention because they don't have anything else to do. If the surgeon is good, is not going to have time to sit down on WhatsApp and talk to you all day. It's just not going to happen. So, and they are very limited in the type of surgeries that they can offer you. There is no way they can offer you gastric balloon, endosleeve, sleeve, bypass, bypass and a high BMI. There is no limitation on the BMI, DS, SADI, you name it, revisional surgeries. So what they do is try to talk you to the type of surgeries they can only perform, and that's really a bad thing. Again, we talked about the power of social media, right? You can put Instagram ads. So that's why you have to do your due diligence to find out what is behind the company. What is it they're offering? Is it just advertisement and just some publicity and advertisement, or is something behind it? I'm very proud to mention about our hospital. This is a project that took me 3 years to get started. We have 3 floors that is basically designed by one of the best architect companies with the best team of medical staff that from the beginning we had all the international and national standards and protocols and requirements. And we have 4 operating rooms, state of the art. Everything in this place is top of the line. And you will see, of course, you know, there are hidden parts of the hospital that nobody sees, like the sterilization or this and that. But I promise you, they have the best systems you can find internationally. As far as the comfort, the rooms are great. Most of the rooms are single bed and they have a view of Tijuana. It's a great experience just going there. As you see our OR, everything is the best of the best in this place. We have actually, since the beginning of 25, we have given the companion option to stay in the hospital with the patient if they want. We do have recliners, but at the same time, we have expanded our visiting time as well from 7 a.m. to 7 p.m. So that's an option. So your companion stays with you the first night in the hotel and they can stay behind in the hotel. Of course, we do the reservation for them, or come with you to the hospital. So that's another great revision we did to our packages. Our approval is very simple. You fill out the health questionnaire. We run it by the surgeon and the surgeon liaison, and you see how the process is. And you can actually book yourself online. And you can choose a date, pay the deposit, and book yourself. Or you can call or email or text our coordinators who are assigned to you, and they book you. This is our packages, basically, from sleep and bypass, ES, all the endo and laparoscopic procedures. We have over 13,000 patients in one of our main groups of support group in Facebook. You get all the support before and after. We have, again, Surgeon Live, we have nutritional webinars. We have a nutritionist staff here in our office. Again, we have a lot of our past patients actually working with us in our team to support you. Sarita, Rena, Dawn, Kelly, Tiffany, and Laura. Actually, Rena and Sarita doing a podcast. I highly recommend you listen to those podcasts. Again, for entering the raffle, if you have a HQ in our system, all you have to do is watch the webinar to the end. If you don't, please submit a health questionnaire HQ by going to MexicoBariatricCenter.com. This is the team of surgeons that are working with us. Dr. Miguel Montalvo, Dr. Alejandro Gutierrez, which is our chief surgeon, and he's present with me today, Dr. Rodriguez Lopez, Jacqueline Usuna, and Dr. Jesus Sea. So this is why you're getting the best screening system possible. You submit your health questionnaire. There is a surgeon lead. First of all, we have developed complex routines and algorithms to match you with the best surgeon to begin with. And then it goes through our surgeon liaison and goes to the doctor that either you selected or we selected for you based on your criteria. The doctor reviews it, it approves it. If it has a recommendation, it includes that. It goes back to the surgeon liaison for another review before it goes back to you. And then surgeon liaison, of course, to look at what medication you're supposed to stop, start, and all that comes back to you. We get about 95% of our HQs approved. About 5% becomes conditional. And so that's why, and then once you sign up with a surgery, you know, let's say a lot of people worry about, should I get a sleeper bypass or DS? The surgeon is going to recommend to you. But let's say you sign up with a bypass or a DS, and you go down there and you still talk to the surgeon before surgery, and you can still change your type of surgery because you still haven't gone to the OR. So there is no worries. You still have opportunities all the way to the end to talk to the surgeon and change the type of the surgery you're going to receive. So it's not like we just stick you there, and like hospitals in the US that sometimes they make a mistake by like working on your left arm or left leg, they work on your right leg and right knee, and they get the wrong one. So the first night you arrive, you either go to Hyatt or you go to the hospital Azar, stay there. The next day you're ready for the surgery. Our pre-op diet is very simple based on your BMI. You start from a low BMI of 2-day clear liquid to higher BMI that requires more time to be on a low calorie, low carb diet. Remember, the pre-op diet is very important because it shows your commitment to what your life is going to be after the surgery. And the better job you do on the pre-op, the easier the surgery is on you and the surgeon, and the easier recovery. So you have to think about it like that. Another thing, like, please stop smoking before and after. Ozempic, people who are taking Ozempic class of medications, please stop few weeks before surgery. No blood thinner, no NSAID. Of course, if you're taking a specific medication, they're going to be telling you what to stop and what to start. However, please bring bottles of your medication with you to Tijuana, even if you're not taking it. I mean, not supposed to take it. That's what I mean. So the flight, we want you to arrive or drive, if you're driving, before 12 noon, and your departure being after 2 p.m. Now, well, we're going to talk about medical tourism insurance, but I want to talk about, remember, we have medical passes, but this is a border that you're crossing from Mexico to US. We do everything in our power with our experienced team of transportation to bring you and make sure you don't miss your flight. However, there are factors that is out of our control. So please be mindful of that. And again, try to book your flight 2 p.m. or after, just to make sure, you know, if you do it after, then you probably may be waiting a little too long. But anyway, this is what you have to remember. And it may not be a bad idea to actually, I'm going to say it this way. I recommend you buy flight insurance. If something happens and your flight changes, then and you know, some of the airlines, they're just not very friendly with switching your flight. They want $800 or something like that. So it would be a stiff price to pay. So sometimes with $25 or $35, you can actually buy insurance, and then it's a peace of mind again. The night that you arrive, you relax. We do the pre-ops, everything ready to go for your surgery day. If you're in a hospital, no problem. We get you to the OR. If you are in the hotel, they pick you up, taking you to the hotel. You stay in the hospital for 1, 2, or 3 nights based on the procedures you go through. And we do the test, pre-op test, post-op test, medication, all that, and you're good to go back home. If you have long flights, you may want to stay a little longer, either in Tijuana or in the US side. We do have a special rate with Hampton Inn by the airport. If you mention our company name, they will give you a special rate. And if you do fly, make sure you move around, don't sit for long hours, or if you drive, don't sit around too long. Just make sure you have the compression socks on. One of the advantages of going with us is we do what we call a surgeon's load management. So we don't give our surgeons a lot of surgeries one day because we have too many patients. So when you go there, you may see a lot of people, but also remember, these patients are divided by 5 teams of surgeons every day. So we give our surgeons enough time off. We don't load them one day because we have to, because we have so many other surgeons that can do surgery. And that's why we have less surgeon errors, because they don't get exhausted in one day and make a mistake. Is a human being. If they do 10 surgeries a day, which we see some places do, one surgeon can make mistakes after the 5th or the 6th surgery, no matter how skilled and good they are. This is the statistics, you can go read. That's why our complication rates are less than 1% consistently. Okay, so Dr. Alejandro Gutierrez is well known. I don't really need to introduce him, but I'm going to say that he is, just to reiterate, he's a double board certified, which means he's a general surgeon plus specialized in doing bariatric surgery. He has so many, certifications, including the FACS of the United States. He's a member of that, and he has done, well, these numbers are probably old, over 6,000 surgeries easily. So a young surgeon, skilled surgeon with that much experience is very hard to find. And his team is unique. So as you see, every surgical team has their own specific team. They have their own anesthesiologist, they have their own instrumentation, they have their own doctor, they have their own internist. So every team is complete. Dr. Gutierrez, I'm going to let you take over and talk about different options and explain the more popular ones. Thank you so much.
Thank you, Ron. Thank you, everybody, for being here, taking your time. We're gonna go and talk about the surgeries that we do. Was reading a little bit of your questions. Some asked about the gastric sleeve, gastric bypass, the differences. So we have all kinds of surgeries. They're FDA approved, ASMBS, IFSO approved, so we can do every single one of them. We could divide them in laparoscopic surgeries. We do our surgeries laparoscopic, and endoscopic therapy. Endoscopic it's recently it's under review. It has good results. Obviously, those are for patients that are on the lower BMIs, but it's an excellent choice as well. So we have well, gastric lab bands. Normally those are on not used anymore. Was a good option back in the 90s. At that time we didn't have the technology, the equipment that we have now. Nowadays, we're doing more gastric sleeves, gastric bypass, mini bypass, switch SATIs. So we're gonna go and look to explain a little bit more about them. Okay, can we go to the next one? Okay, so we have, first of all, we have the gastric sleeve surgery. This is the most common bariatric procedure done in the whole world. It's a simple procedure. We just go into the stomach and we're gonna, what we do is that we're gonna remove like 80%, 85% of your actual stomach. So leaving a very, very tiny portion of your stomach that looks like a sleeve. So the goal is for that small stomach, you get full very fast. The other portion of the stomach, we take it out of the body. So we were talking a little bit about hormones. We know that in the fundus of the stomach, specific portion, it's where the ghrelin, which is it's called a hunger hormone, is produced more in the body. So after taking this part of the stomach, you don't have that hunger hormone or much less in your body. So normally that hormone goes into your brain and causes you that binge eating, those cravings. So patients after surgery, they don't get that anymore or much less. So that's the advantage of gastric sleeve. Obviously, we were talking a little bit about bariatric surgery. Since 1991, it was the National Institute of Health in the United States determined that bariatric surgery is the most effective and long-lasting treatment for obesity. So since then, could be another medication that help, right? But we don't have long-term data. But still, bariatric surgery is the most effective so far. Okay. We have another one that's the SILS, we call it a single incision gastric sleeve. It's a gastric sleeve on the inside, the same, but the difference is we perform it through a single incision only, through the belly button. So obviously, this is more for aesthetic purposes. You have to meet some criteria. Your BMI has to be low, some other factors, but it has the advantage of having the results of a gastric sleeve with no scars or minimal. Okay. We were talking about endoscopic procedures. One of them and the most done nowadays is the endoscopic gastric sleeve surgery. This is, we do it through an endoscope, okay? So it's no surgery, it's just you slice sedation. We do it under endoscope, and we have a special component in the endoscope that we can use it to stitch the stomach on the inside. So we mimic a sleeve with a gastroplicature. So we have we put some special sutures that decrease the size of your stomach. So it has good results so far. Obviously, doesn't have the results as the surgery, but for patients that just want to drop a little bit of weight, they don't have any other diseases, so it's an excellent choice. We have the gastric bypass surgery. Gastric bypass was done since 1950s. Obviously, it was done openly. It's still considered the gold standard of bariatric surgery. What we do in the gastric bypass is that we're gonna go to the stomach. We're gonna cut the proximal portion. We call it the gastric pouch. And second step, we go to the intestines. Since the beginning, we're gonna count like 6-8 feet average, depending on different factors. And what we do is that we cut the intestine down there, take the distal limb, bite it into that pouch, into the stomach, and the other limb, we bite it into the same intestine. It looks like a Y. So what happens is that food, instead of going through the complete intestines, it's gonna bypass a big portion of it and go to the last portion. So it has, your body's not gonna be absorbing as much calories as without the surgery. Obviously, we have to take in mind that it's not gonna be absorbing calories, but it's not gonna be absorbing vitamins and minerals as well, protein. So we have to do a good diet and keep taking our vitamins and minerals after. That's a common question that patients said, it's the gastric sleeve good for me? Sometimes you see, obviously we do more gastric sleeves in the whole world that gastric bypass. So you can see more patients regaining the weight after gastric sleeve. Obviously, both of them are an excellent choice. Obviously, the gastric sleeve is less invasive, but you have to take more maintenance, have to follow more the indication, the rules, so you can regain weight. Obviously, in any, I tell my patients, all of these surgeries are an excellent tool, but are still a tool. You have to make some changes. So if you're that patient that have like another diseases, diabetes, metabolic problems, acid reflux. So in those cases, we prefer to go to Roux-en-Y gastric bypass instead of the sleep. But other than that, if their BMI is low, they are gonna stick to the diet, they're gonna stick to the indication. Gastric sleep is an excellent choice as well. Okay. We have some kind of gastric bypass. It's a gastric bypass, but this is called a mini gastric bypass. Yeah, it should be called one anastomosis gastric bypass. It's called mini because it's less surgical time, 15, 20 minutes less than the Roux-en-Y. What we do is that we're gonna go to the stomach, we're gonna cut the proximal portion a little bit longer, still is a gastric pouch. Second step, we go to the intestine, we're gonna count like 6 to 8 feet average, but the difference is we do not cut it down there. We take it as it is, and we bite it into that stomach. So in surgery, we call it an omega loop. So it has the advantage of, instead of having to cuts, to suturing, to potential sites of bleeding or leak, it's just one proximal reachable by endoscopy. So that's the advantage. And the results so far, we have like 10 years in results, and the results are the same as the Roux-en-Y. So we got amazed with that. So it's an excellent choice as well. Okay, so gastric bypass or mini gastric bypass. First of all, what we need is that if patient previously, before the surgery, they have like bad acid reflux disease, Barrett esophagus, kind of like that, we prefer to do the Roux-en-Y gastric bypass. Other than that, the mini gastric bypass is an excellent choice as well. So, and depends on different factors. Obviously, whenever you're here, we're gonna go through your background and tell you the best procedure that's suitable for you. Okay. We have the duodenal switch and the SADIs. These are a more like invasive surgeries, but obviously the results are better, are bigger. In these cases, what we do in both of them is what we do first do like a sleep. We're gonna do a gastric sleep, and second portion we're gonna do like a bypass, but instead of doing it in the same stomach, we're gonna do it in the duodenum. So the SADIs gonna be the same. We go, but in this case we start counting the intestines since the last portion, since the colon. So we count like around 3 meters, sometimes a little bit longer, average. In the SADIs, we take that intestine and bite it into the duodenum, and in the duodenal switch, in the BPD, we cut the intestine and choose anastomosis as with the Roux-en-Y. So you're gonna have like only 3 meters of intestine absorbing calories. Still, you have to be more careful with vitamins, minerals. Patients, if they do not take proper care of the diet, they can have more diarrhea. But if you are willing to follow indication, all of that, this is an excellent choice as well. So we're talking a little bit difference of both of them. It's kind of like the duodenal switch is the Roux-en-Y, and the SADIs is the mini gastric bypass, kind of like that. In both, you can see that we're gonna do a gastric sleeve, and the other, the intestine is just a cut or an omega loop. So it's a Roux-en-Y or an omega loop. So the same. It has a difference with the gastric bypass, that in the gastric bypass we cut the stomach. In these cases, we preserve the pylorus, which is a bulb. So that's an extra help. Okay. A common question: patients that have PCOS or patients that want to get pregnant, and have tried and without any success. PCOS is related to hormones related to obesity. So after losing weight, PCOS gets better or even gets treated. And as well as with fertility rate, we have a lot of patients that after surgery, they get pregnant once, twice, and they're very happy. So yeah, if you have PCOS, this is a good treatment for it as well. One of the common questions is that how soon can I return to work? So this is gonna be depending on different factors, type of work that you do, very important, the type of procedure that you had, and what kind of work you do, if you have any other diseases or kind of like that. Normally, we recommend in all procedures to do like 2 to 3 weeks. But it's gonna depend. Normally, if you're on a desk job, not carrying or lifting heavy things, so we can try 2 weeks. Some patients even return in a week, depending on how do you feel. We have to keep in mind that you're gonna be doing a pre-op diet, you're gonna be fasting, and continue a special diet. That the first week is just liquid. So sometimes patients feel low on energy the first 2 weeks, approximate, but then after they're gonna have double energy. So keep that in mind. And normally we recommend always like 2 to 3 weeks in patients. Okay.
I really appreciate it. Thank you so much. I'm going to take over here and just a little note about financing. Our packages are extremely affordable. However, if you need to borrow money, probably your bank is, if you have a good relationship with your bank or you credit union, those are the places to look for money first. And if not, you can look into other financing options. We have several on our website, like Super Money, e-financing, Medicard for Canadians, or look for other lenders like Lending Tree, Lending Club, SoFi. But make sure you don't apply for so many places at one time because it's going to affect your credit score. I told you one of the advantages of going with us, you get a deeply discounted medical tourism complication coverage, which we call MTI. Medical tourism insurance covers complication, any interruption in your travel due to complication, and it covers you 45 days even after you arrive home. And for the price, this is a great option. I highly recommend everybody takes advantage of that. This is basically 50% off of what it's supposed to be. So please take advantage of that. Again, we have extensive nutritional program, which we call it Nutrition Support Plus. We do offer Emerge Bariatrics, which is our own vitamins, line of vitamins for bariatric patients. These are made according to the ASMBS standards for post-bariatric patients. It comes in soft chew, chewable, drinkable capsule. We did that really to make sure our patients have a long-term success, because when it's like the first 2 years after the surgery, after you acquire this tool, life-changing tool, it's like a honeymoon. You lose weight. But your nutrition, your lifestyle, your activities are huge because that's what makes your long-term success. And these vitamins are extremely important in your long-term 7, 8, 10 years out of your bone density, your nervous system. All that makes sure is intact. So again, our website is extremely informative. There's a lot of information there. Make sure you check out our blog posts that we post almost every week, every other 2 weeks. And now we're going to open up to Q&A. And pretty much in 1 hour, we covered everything we had to do so we can get to your question and answer. Let's go back. So if you are, again, if you have an HQ in our system, or if you're already scheduled for Dr. Gutierrez, these are all you already going to be in the raffle pot. But this raffle only for Dr. Gutierrez and the procedures that he offers. One thing I was going to cover, and I didn't get a chance to go over, was how to calculate your ideal weight or your goal weight, which is something like, because I saw a question somebody asked, I'm like 169 pounds. What's the best procedure for me? Depends on what is the extra weight that you need to lose, right? Sometimes they show like by X percentage of extra weight and this and that. It's kind of confusing. So this is a good table that I always work with. So based on your being female or male and your frame size and your height, you can pretty much see where you need to be, right? So let's say if I am 6'2", and I'm a male, and I'm like a medium frame, I need to weigh about 190 pounds, right? Somewhere between 190 and 200. Okay, so let's say if I am supposed to be 200 and I'm 250, right? So I have 50 pounds over. If I am 300, now I'm 100 over, right? So, and then there is actually something that we're going to include next time, hopefully, is to show you the amount of weight our patients lose based on different procedures. And the literature shows you that, okay, well, you lose 65% of your extra weight if you get sleep. So let's say if I'm supposed to be 200, but I am 300, after surgery, I'm supposed to lose about 70 pounds, right? 70% of my extra weight, which is 100. But we see in our patients that most of them are actually losing all the weight, extra weight, no matter what. Some lose, let's say if they are 400 pounds, they lose 200 pounds to get back to their ideal weight. So when you ask, I weigh this much, so your weight, your sex, your frame size, your height is all a factor to determine where you need to be. And of course, your goal weight could be a little different from your ideal weight because sometimes you want to be a little bit more chubby or a little bit more skinny, right? So you could adjust that. So that's why you acquire this tool, which is surgery, which is bariatrics, to be able to work with it to get to where you want. But it is a tool that you need to work with. okay? And it's not going to do it by itself. You have to make your lifestyle changes. You have to change your activity level. Of course, the lighter we get, the easier it is for us to be moving, walking, running, doing workout, right? Let's see, there is a lot of, I haven't seen this much conversation before. So it's very hard to know which ones are, okay, I guess. Okay, so you want to talk about if the patient has C-section before. Is that a problem?
Okay, yeah, sure. Obviously, we have a lot of patients that had previous C-sections. So normally, any pelvic or surgery like hysterectomy or C-sections, uh, normally it's not much of a problem. Sometimes it's a little bit of adhesions or scar tissue that we can encounter, but because it's slow and we're gonna work on the upper part of the body, so it's not much of a problem. I was thinking I had a patient with like 6 C-section once, I think. So yeah, so no, it shouldn't be any problem.
There was a question they asked, how long it takes to perform the mini bypass?
Okay, yeah, well, the mini bypass, it takes like around hour and a half, sometimes 2 hours, average. Gastric sleep is 40 to 45 minutes. The Roux-en-Y is around 2 to 2.5 hours, sometimes 3. And the Sadie's or switch, it could be like 3 hours average. So those are the hours, depending on type of patient and if they have previous surgeries, have to remove scar tissue, or if it's a revision surgery.
There was another question. They asked that for reasons like reflux and diabetes type 2, I was recommended to get gastric bypass. First of all, I want you to know, again, reiterating that the surgeon is going to recommend what's the best for you. And you still have a chance to talk to them before surgery. But let's say this patient is set to go over bypass. They said they already lost 10 pounds. Is that going to disqualify them for bypass? Again, because we don't know their weight, but can you maybe answer that?
Yeah, of course, yeah. Well, in this case, the Roux-en-Y gastric bypass is considered an anti-reflux surgery. So in patients there are the BMI is over 30 and they have acid reflux, actually the surgery of choice is to do the Roux-en-Y gastric bypass. So sometimes we have done surgeries, revision surgeries of patients that have a little bit less than 30, 28, 29, but they have severe acid reflux or even with GERD or Barrett esophagus. So in those cases, we still do the surgery because our main goal is to take that acid reflux away. So yeah, it's indicated in this case.
There's a patient asking that I have hysterectomy in a few days. How long after that can I get gastric sleeve done?
Yeah, well, it's gonna depend how many how much days was that before, but yeah, normally we can still perform the surgery without any problem.
How many days after?
After a cystectomy,
Hysterectomy.
hysterectomy, well, that will be depending on if it was laparoscopic, openly done. I think in this case it was laparoscopic. So in that case, I think 6 months will be the best, but depending if 2 to 3 months, if you're doing okay without any problems, we can still be able to do it.
One thing I want to note here is we do perform laparoscopic hysterectomy in our center, and at some occasions we could do the sleeve with the hysterectomy in the same procedure. It's not highly recommended, but we could do it in the same procedure, just FYI. FSA, we don't really take FSA. Our website's credit card payment may take your, if you have a credit card that has that type of funds in them, you can try. Sometimes it goes through. Most of the time it does go through, sometimes it doesn't. So I would suggest that you go to our website and try to make a payment for deposit, see if it works. Again, the companions from the beginning of 2025 has option to stay with the patient in the hospital or stay behind in the hotel. Of course, there are advantages either way. If you really, really want your companion with you, you can take him with you. We offer recliners in some rooms. They can stay there. Let's see. There was another question they said. So I was reading, Dr. Gutierrez, about like a 15-year study that showed how effective DS is versus bypass. So again, you guys cannot shy away from duodenal switch or bypass to say, hey, this is too invasive. You have to look at each person is different, your lifestyle, your age, your genetics, all that, and then look at the long-term effects too. The good thing about sleeve is that you can easily convert it to bypass, mini bypass, DS. Or bypass and DS is harder to revise, right? It's not as effective, right?
Yes. Oh,
Yeah,
sorry.
right.
Yeah, since we work already on the duodenum, and duodenum is it's very delicate. So working on a previously worked duodenum and doing another anastomose down there is trying to like to revert the previous surgery and do another one. So it could be hard or complicated, but still we can do it. But obviously a revision from sleep to another one is easier.
So the packages I offered, the prices that I showed you is not for every surgeon, first of all. That's our starting prices. And there are additional fees, like let's say if your BMI is over 49, not 48.9, 49. Again, 59. These are the break that you have to pay extra. Another thing, Dr. Gutierrez, if you want to explain, is about hernia repair.
Okay, yeah.
Yeah,
Well,
good.
yes, thanks. We have the diaphragm. Normally that diaphragm is a muscle that divides the thorax from the abdomen and has some special openings for structures to pass, aorta, esophagus in this case. And normally that opening could increase because of pressure. And patients that are overweight, they have their abdominal pressure increase all the time. So up to 30% of patients that are overweight could develop a hiatal hernia. So what happens if that opening increases in size? The esophagus, what happens is that it pulls the stomach through all the way to the thorax, part of it, or sometimes a complete stomach. So we have a special valve in between the esophagus and the stomach, but for that valve to work properly, it has to be in its proper place. If it's down here, it's not going to work. So most commonly patients could have acid reflux. Sometimes they don't have symptoms or they don't know. But whenever we do any restrictive procedure as the gastric sleeve, we go and check if there's no hiatal hernia. If it is, it's always better to dissect and repair it, because if not, you can have that acid reflux gonna get worse or appear if you don't have it. So it's better to repair it at the same time.
Okay, so let's see. Again, this patient is asking, Dana was asking, So once we finish with this webinar, it takes us a couple days, but we do publish it. And if you want, you can ask us to send you the link so you can watch it again. So you kind of explained about GERD and, you want to explain a little bit more about it because that's a lot of questions about.
Yeah,
GERD.
well, yeah, it's becoming more commonly nowadays. GERD, or it's gastroesophageal reflux disorder. It's a disease that it's mostly comes with acid reflux. Acid reflux is a multifactorial disease, so you could have it because of overweight. That was very important. We were talking about the pressure, stress, your diet, different factors. So obviously in patients that are overweight, they can develop more acid reflux. What happens is that that bulb, the upper esophageal sphincter, it has to be in its proper place to work. And if it's not, acid reflux and the food that you eat, it's coming to the esophagus from the stomach. So the stomach, it has a special tissue prepared to deal with acid and food, but the esophagus doesn't. So what happens is that the esophagus starts to develop, your body starts to develop another tissue, a special tissue, but that tissue could lead into cancer, esophageal cancer. That's called Barrett esophagus. So, and GERD produces a lot of other symptoms. Acid goes all the way to your nose. It causes sinus infections, throat, your lungs, causes asthma or other problems. So ears, infections. So sometimes patients, they don't know. In other cases, patients have to be sleeping seated, or they're wake up in the middle of the night with all the acid and the pain. So the problem is that this could lead to cancer in the future. So that's why it's very important.
By the way, I released the Zoom poll, and that was one of the requirements to be able to participate in a raffle. Please go ahead and complete that. Okay, so let's go back to the questions.
A lot of them.
Yeah, we have a lot of our patients actually come alone because remember the time from the time you land in San Diego International Airport, you are going to be accompanied with our staff. Whether the driver takes you there, they take you to the hotel, for example, or hospital. There are coordinators in the hospital. There are coordinators in the hotel. Everybody is attentive to you, so you're never alone until you go back to fly back home. So there is really no need to bring a companion, but some people do want to bring him, but that's fine. But most of the patients come alone. Did you explain, Dr. Gutierrez, about ESG and what is the qualification? Like, what is the BMI? Because like ESG and those are not like for everybody, right? So gastric balloon.
Yeah. Well, a gastric balloon, it's a good option, but both of them are for patients that are lower BMI, preferable that doesn't have any other disease. With gastric balloon, we put a balloon under endoscopy, and normally it's a 6-month balloon. Patients, they lose like around 30 pounds, so it's a little bit of weight. And then you have to come back and with endoscopy to take balloon out. some brands. And with the gastric endoscopic gastric sleeve, what we do is that we use a special equipment that could make we put some stitches inside, make it smaller. Obviously, it doesn't have the results as the gastric sleeve, and normally it's for patients that their BMIs are low and they don't have any other disease, or the other way. Sometimes patients that are very, very heavy and they have other diseases, they cannot tolerate surgery. So in this case, this is an excellent option because we put the balloon or the ESG and they lose a little bit of weight, so then they can return and do the surgery because of heart conditions, lung, some other. So in this case, it's a choice, another choice.
Andrea is asking, I had sleeve 8 years ago and I've put some weight back on. Is my mini bypass the only choice?
No, you can revise it to a mini bypass, Roux-en-Y gastric bypass, even a Sadie's, but that will be depending on your background, your weight, and all of that. But normally, when patients regain weight from gastric sleeve, we prefer to do a revision because in some centers they offer a re-sleeve. The re-sleeve, the results are not that great, but only if you have just a few pounds, or in the beginning, the gastric sleeve was not done properly, and sometimes they left a lot of stomach. So in this cases, we can make a proper sleeve. But yeah, in this case, I think the bypass will be the best option, but we have to go into your background and see what's the most suitable for you.
They're asking, what are the worst side effects after surgery aside from pain? And how do we know when to seek help?
Okay, well, meaning side effects or complications. Obviously, complications, as is in any surgery, you have to take care of bleeding. It's in any surgery, and leaks, which we take care here in the hospital. And there are less than 0.5% worldwide data. Here in the center, we have less than 0.3%. So obviously, you have to learn that it's going to be a change. We recommend after surgery to separate liquids from solids. In gastric sleeve, you're gonna feel full very fast, and if sometimes you eat too fast or a lot of food, you're gonna feel bad, gonna feel nausea, vomiting. So that could be a side effect, but you learn how to eat the proper way back again, chew properly. With gastric bypass, we could have the dumping syndrome, which is the same if you eat too much carbs or protein, like too fast. You can our body start to develop and create some hormones. You can have like start to sweat, blurred vision, pain, abdominal pain, diarrhea, or sometimes even faint. That's called dumping syndrome. Sadie's or switch, if you do not take care of your diet, sometimes you can have diarrhea, but those are treatable, and those are depending on you taking care of your diet and following medications.
One thing I want to mention is, of course, when you start looking for getting the surgery in Mexico, you see all these ads, and so I just recommend again to read reviews, do your research, don't price shop, because this is your health and this is your well-being. Our prices are very affordable. I think for the services we offer, I can assure you there's no company can offer the same prices we're offering for the services that you're getting, for the support you're getting. But just be careful what you select for a few $100s, because that just long-term it will be, you know, it would not be worth it to you. So they're asking, I'm getting a revision surgery. Oh, by the way, we gotta have a revisional webinar next week, Saturday at 10 o'clock. So you guys who are asking for revision or you have a specific revisional questions, you can attend our next webinar next Saturday, which is going to be 18th of January at 10 a.m. Pacific. But they're asking, I'm getting revision surgery from Roux-en-Y gastric bypass I got in 2008. What would be different in this surgery?
Okay, what we do in gastric bypass revisions, we go and check two aspects mainly. Sometimes, well, it was a long time ago, so sometimes the pouch, that it's the stomach, that's small, stretches. So in that case, we make it smaller back again. We have to check in some cases, from the new stomach that we create, the pouch, and the stomach, the native stomach, it creates a communication. We call it a fistula. So food can pass into the stomach and go all the way through the complete to the intestine. So that's why patients are absorbing calories and regaining the weight. So we have to check in there's no fistula. And the second of all, very important, back in those days, they were afraid of patient getting malnutrition if they did a long bypass. So we encountered that around that age, though that time, they did like a feed, 2 feet of 3 feet of a bypass. Nowadays, we're doing it 6, 8 feet because we've seen that patients regain the weight. So in this case, we call it distalization. So that bypass that you have, we're gonna make it longer. So not that's gonna add an extra malabsorption help.
Okay, so as far as the payment, so you pay a deposit when you first sign up, and then the rest is basically due for 15 days before surgery. From 21 days, we start asking you what form of payment you're going to make. If you are bringing a cashier check, very simple, just take a good picture of the check and send it to your coordinator so we know you're bringing a cashier check. However, we do take credit card. There is some processing fee for credit card, but everything else has no processing fee, cash, cashier check, wire transfer, all those you can do to our bank accounts. We do take Zelle as well. There was another question that I lost. It was a female that was 5'6". I'm actually going to check her BMI here. There's a lot going on. So let's see. Okay, so so this table again is a great tool for you based on your sex and based on your frame size and height to see what is the ideal weight that you need to be and how much you are at now, and you can calculate your extra weight. Lori's, oh, that's our Lori says, I had sleep with Dr. Rodriguez last June and I'm down 145 pounds. Yeah, that's congratulations.
Very good, Lauren. Very good.
Patty. Again, our past patients are helping us day to day with our past, with our future patients. And this is a kind of support you're getting. So again, when you're trying to just compare prices, there is no comparison of what the range of surgeries, the type of surgeons we use, the center that you go to. That hospital is state of the art, comfortable experience. Okay, so I think we are pretty much covered a lot of the questions. What was this thing about COVID? Okay, so yeah, so we pretty much covered. Again, you guys have a chance. We're gonna announce that hopefully next Wednesday we start. So if there is no webinar, Saturdays at 10 a.m. If there is a webinar Saturday, you can jump on the webinar, talk to the surgeon. On the weekday, we're gonna have one session Q&A with the session with the surgeon only, and we're gonna rotate that so you have a chance to ask the specific questions. I have all the names that qualify to be in the raffle here. Oh, top one. So I'm going to pull one name and see who is the lucky winner. Trisha Soto. Let me find you here. That's our lucky winner for today. There you go. I'm going to let you talk. Please say your name again. You are mute. And tell us about yourself, where you live. Okay, there you go. Hi.
Hello.
Hi.
Hi.
How are you?
I'm doing good. I'm excited.
Yes. Where do you live?
I live in Washington State,
Okay, great. So
and all the information that you guys provided me is very helpful, and I've been looking at doing surgery for like over 2 years. So this is like really something that I've been wanting. I'm a single mom. I have 6 kids and I'm a grandma. 35 years old. I've been overweight for most of my life. The lowest weight I've ever been is probably 158, and since I haven't been able to get down to that weight, so I'm pretty excited that that I actually was the person to win the raffle today.
Mhm. Well, that's so great to hear from you. And this is a great opportunity. Of course, this is a really life-changing tool that for everyone, but you get even a $2,000 off, so it's even better for you. So please contact our coordinator that is assigned to you, and we get you set up to go.
Okay, thank you all so
Right.
much, and I can't wait to meet Dr. Gutierrez.
Yes, yes,
Likewise. Congratulations.
yes.
Thank you so much.
Well, thank you everybody for attending. Again, we have a revisional webinar next Saturday, and we will stay in touch. Thank you so much, Dr. Gutierrez, for taking your time and for being with us today. Okay, we'll see you next time. Have a good day.
Have a
Bye-bye.
good day. Bye.